Erectile dysfunction after a prostatectomy is something that nearly all men will have at least for a short period of time. After experiencing erectile dysfunction after a prostatectomy, many people are scared that they will never experience an erection again. The good news is penile rehabilitation and care can help speed up recovery and ease erections for those with ED post-prostatectomy. I want to go over my top 5 things you can do to help an erection return after your prostatectomy surgery. But first, I want you to understand something. Removing the prostate is a very delicate procedure, and surgeons are extremely well trained to be able to do just that. During the procedure, to make sure that you don't bleed out, surgeons often use instruments that cauterize the blood vessels in the body. The heat from the cauterization can be somewhat damaging to these nerves, as nerves generally do not like heat, leaving many men frustrated and scared that they won't be able to get an erection again. The good news is nerves heal, but they tend to heal slowly and can take up to 2 years. So in this video, I want to walk you through my top things that I tell patients about getting an erection faster following a prostatectomy. Hey there, my name is Dr. Joseph Rosie. I'm a licensed physical therapist, and I help men regain continence and confidence after their prostate surgery to feel like a man again. So erections are all about blood flow. There's no bone in a boner. It's just blood flow that is filled in 2 chambers that are on the sides of the penis. When you get aroused, your pelvic floor muscles drop down, allowing blood flow to pull in the bottom of the pelvis and fill these chambers. The pelvic floor muscles then trap that blood flow in to allow you to maintain an erection. Now, these muscles also allow your soldier to stand up to salute your partner. So we have to make sure first they are getting blood flow in the area. And that's the first thing, being overall healthy and maintaining a healthy weight to allow blood flow to circulate throughout the body. If you're unable to maintain moderately good health, you're going to have a harder time achieving an erection. Now, side note, this is one of the biggest reasons that men who don't have this surgery are unable to get and maintain an erection. It's because they aren't even healthy enough. Your boners, your erections, are a barometer of your overall health. The second thing is getting started on a low-dose med that is prescribed by your doctor. I tend to find doctors prefer to prescribe Cialis after surgery, and many men are taking it home with them. They tend to take it like a daily vitamin. Now, I don't prescribe meds, but this is what I tend to see. The good thing about taking the pills is men tend to have a high compliance rate than what's next. The third thing is a vacuum erection device, commonly called a penis pump. Now, as a physio, I absolutely recommend men use a penis pump. Let's talk about this for a moment. First, a penis pump is really used to maintain tissue length and to maintain the ability for blood flow to maintain in the chambers that we talked about before. Now, as you can imagine, if these tissues are not getting used, then they can scar down and limit mobility later. The second thing is many people may not be aware of this, but every guy tends to get nightly boners, usually 3 to 5 of them that can last 20 to 30 minutes. This is completely normal and healthy. So why use a penis pump and how often? So you want to use it to get blood flow in the chambers and keep the penis stretched out. Now, I'll be honest, many men aren't in love with the way they feel, but it's one thing I absolutely recommend getting started with. I will put a link in the description below of one that I tend to recommend. You can get it at a local sex store, but as most people tend to not like walking into one, you can absolutely order one online and get it shipped straight to you. Okay, so fourth thing is a C-ring or a penis ring. This is generally used after a penis pump around the base of the penis to maintain blood flow in the chambers. Now, you will want to start slow and slowly ramp up with a max time around 30 minutes. I'll put a description of one below. Lastly, and most importantly, is pelvic floor muscle training. The pelvic floor muscles work collectively to bring blood flow in and trap it in the penis until climax is achieved. So here's how the muscles do this and how they may need to be retrained. First, the muscles need to relax, and I mean fully relax. As they relax, the pelvic floor muscles depress, allowing blood flow in, as I mentioned earlier. Now, all too often, especially with men trying to overcome urinary incontinence, they tend to overdo Kegel exercises, causing adaptive shortening to these muscles, thus not allowing them to fully depress. So that's one area that these muscles need to be retrained. They need to be relaxed. These are commonly called reverse Kegels. Next is getting these muscles endurance that is strong enough to last long enough to maintain this erection. So another fun fact, often when these muscles lack the endurance, some guys may come quick as the body fatigues and needs to ejaculate due to muscle fatigue. So first, reverse Kegels to make sure that you're getting full relaxation of the pelvic floor, and second, endurance to maintain a stronger pelvic floor contraction to maintain blood flow into the penis. Now, in total, this vastly differs from person to person and can take up to a couple years. Often we see most men getting back to erections around 9 months. I know that's a lot of time, but when the time comes, wouldn't you rather be ready? I hope you found this video helpful. If you have, do me a favor and give it a thumbs up. Subscribe to the channel for more videos like this. Thanks for watching, and I'll see you in the next video.